Okay, welcome everybody. This is the video podcast for Chapter 11. This will be one of our first installations on the muscular system. We'll be talking about the muscles of the head and the neck, so the cervical, the cephalic, the facial, and the nuchal regions. So let's take a look at skeletal muscle. Remember that skeletal muscle is one of the three muscle types. It is under voluntary control, meaning we tell it what to do, when, and where. And the other two muscle types are smooth muscle and cardiac, both of which are not controlled by conscious thought. Smooth and cardiac muscle receive the primary bulk of their input from the autonomic nervous system. Remember that the autonomic nervous system is that division of the nervous system that works beneath our conscious awareness, but nevertheless is extremely important in the maintenance of body function. Okay, so with regard to skeletal muscle, one of their primary roles is to produce movement. They're attached to bones by tendons. Well, what are tendons? They're connective tissue. They are dense connective tissue, meaning they're relatively tough stuff. And because they are connected by connective tissue, these connections are reasonably strong. Connective tissue, remember, has as one of its primary characteristics very few cells and a whole lot of extracellular matrix. Well, in the case of tendons and ligaments, the extracellular matrix is made up primarily of a very powerful protein called collagen, which resists tearing, stretching, and straining. Notice also, you can see in this picture, that tendons and ligaments tend to have a very pale color. And the reason for that is that they have a very low blood supply, which means that when they experience injury or damage, it takes a long time for them to heal, for those wounds to repair. So this is one of the reasons that individuals with ligament tears or tendon sprains have a long recovery time. Muscles are attached at two different places. The first attachment is the origin. It's the attachment of the muscle to the more stable region of the two elements. The origin is generally where the muscle is attached to what does not move when the muscle attempts to produce motion. So think of origin as the stable end of the attachment, and the insertion is where the muscle is physically attached to that object that's going to move. Okay, in the case of the biceps brachii, which is the muscle you're looking at here, what we have is an origin at the coracoid process and the supraglenoid tubercle. Well, those are essentially portions of the scapula, and what happens when the biceps brachii contracts is that its insertion point, which is on the radial tuberosity, is then brought closer here to the humerus. So the radius and the humerus reduce their angle between them. That's arm flexion, elbow flexion, and that produces the movement. So this is the insertion, and these guys up here are the origin. Okay, you can see the origins sort of listed here. Okay, from the scapula and from the humerus. And here we're looking at a different muscle. We're looking at the triceps muscle here. Now notice that the tricep has its insertion on the ulna and its origins also on the scapula, just like the biceps brachii, but also has an origin on the humerus. Now the triceps is what's called an antagonist, and what it does is it opposes the action of the biceps brachii. So when it flexes, what it does is it increases the angle between the radius and the humerus, and so the elbow straightens out. When we look at muscle movement, generally what you see are groups of muscles, some of which work together, and those are called agonists, and some of which work against each other, and those are called antagonists. And it's important to have both types of muscle groups in order to achieve smooth movement. And this basically allows the contraction of the muscle to occur in a flowing, smooth, controlled fashion. Whereas, for instance, if you didn't have a tricep muscle and you just had bicep action, the arm, when it flexed, might move upward in an extremely jerky and uncontrolled fashion with no antagonist to work against it. So this is one of the reasons that we have to be conscious of these muscles, their origins, their insertions, and what they do. The belly is the fleshy portion of the muscle in the middle here. Here's the belly of the bicep and the belly of the tricep. You can see here. And the action is what the muscle does when it shortens. So in the case of the biceps brachii, we have elbow flexion. In the case of the triceps brachii, we have elbow extension. A couple of descriptors for what they do. Reverse muscle action, or RMA, is the action of the muscle when the inserted tendon is stabilized and the origin tendon creates a pull on the bone. And so what happens now is that we affect a movement of some type. Now when we talk about movement, we have to sort of talk about joints, which we addressed in the previous chapter, and we have to think about what levers are. Levers are mechanical devices that allow us to move an object, and one of the most important aspects of the lever is the fulcrum and the lever arm. Basically, the lever arm is the distance between the applied force and what it is you're trying to move, and it is generally a physical part of the lever, and the fulcrum is what the lever is pivoting on. The effort can be applied at different places. In this illustration, the effort here is applied at the radial tuberosity. The fulcrum, what actually produces the area where it's going to pivot, is right here at the elbow joint. And the load, in this case, is the arm itself, the forearm, and whatever else the forearm might be attached to. In this case, we're holding a load of some type. And so when the biceps brachii contracts, what happens is that we decrease the angle between the humerus and the radius and ulna, and that's considered to be flexion. The longer the lever arm, the easier it is for us to affect a movement. And the reason for this is that the distance of the lever arm multiplied by the effort that you apply to it increases the total force. And so the best illustration I have of that is if you've ever tried to jack up your car when you've had a flat tire. You get that jack that they give you out of the trunk, and you loosen the wheels before you jack the car up, and then you set the jack under the front bumper, and then there's usually a pipe or some sort of a fitting that slides like a sleeve over the portion of the jack that is essentially now the lever arm that you're going to be using. You apply the force at the far end of that lever arm, and you're able to lift a car that can weigh a ton or two right off the ground with simply the effort that you're applying to this device. If you didn't have that lever arm there, if you tried to jack your car up and your force was applied really, really close to the load you're trying to lift, it'd be very difficult for you to move that object. You can also demonstrate this to yourself with something as easy as a door, okay? Notice how easy a door is to open and close when you use the handle on the door, which is at a significant distance from the fulcrum, the hinge on the door. But if you try to open and close the door by pushing really close to the hinges, you have to apply a lot more force in order for the door to swing open. And the reason for that is that the distance between the force you apply and the fulcrum is much less, so the mechanical advantage from the lever arm is greatly decreased. So a lever is a rigid structure that can move around a fixed point. The bones act as the levers. The fulcrum is the support around which the lever pivots. The joints act as the fulcrum. The effort is the energy or force that allows the movement to occur, and here we're using muscle contraction as the producer of the force. The load or the resistance is the weight that's carried or supported and the force that opposes the movement. So the movement is going to be in the upward direction here, right? And the load, as a result of gravity, is producing a force in the opposite direction. And so in order for us to move the load, the force that we apply has to be greater than the force in the opposite direction. Otherwise, we're not going to be able to, in this case, pick up this brick. All right? So it's only when the force that we apply times the lever arm is greater than the load that we can actually move the load. Otherwise, all that's going to happen is that we're going to stress and strain and we're not going to generate any movement. So this is why you can see the lever arm so important. It multiplies the applied force. So if we apply a certain amount of force here, the longer the lever arm is, the greater the force becomes at this point, because we're able to multiply it by the distance between where the effort is applied and where the load is being moved. And here you can see some different types of levers in the human body. Notice where the loads, the fulcrums, and the efforts are. Let's look at these nuchal muscles. Okay, remember the nuchal region is the back of the neck, and what you see here is the splenus capitis, it looks like, and it attaches here to the occipital bone of the skull, and it's a paired muscle. You got one on the right and one on the left. And what happens is the weight of the head will tend to bow forward. That's the load here. This is the gravity acting on the head. So as the head tips forward, if you apply a contraction to the splenus capitis, oops, sorry about that, what will happen is that it will pull the head back in the other direction, and the fulcrum around which it will rotate is the joint between the skull and the top of the vertebral column. So if you remember there, that's the atlas, and also those slightly movable joints in the intercalated discs, the intervertebral discs, which are those little pieces of cartilage in between each of the vertebrae. And so what happens when the splenus capitis contracts on both sides, the left and the right, is that the head will lift back up. Here you've got another example. You've got the gastrocnemius, which attaches to the distal end of the femur and down here to the calcaneus. And what happens when the gastrocnemius contracts is that the toe will point. Okay, so where's the effort? Okay, the effort is here in the belly of the muscle, and the fulcrum is here, the ball of the foot, and the load in this case is the weight of the body, okay, pressing down on the plantar surface of the foot. So what happens here when we stretch, or when we flex the gastrocnemius, is that the toes, the weight of the body, will lift off the ground, okay, like you're standing on your tiptoes, and the body will elevate. So that can be a very powerful muscle, right? If you're standing on your tiptoes, that's the whole weight of the body. And here we have the example with the biceps brachii, which we've actually already addressed, the fulcrum being the elbow, the effort here being the bicep muscle. This is where the effort's applied, and there's the load, the weight of the forearm and whatever happens to be in your hand. So levers can come in different types. But what's the most important thing to understand about these levers is that the longer the lever arm is, the greater the applied force at the point of the load. And so the mechanical advantage is dictated strictly by the length of the lever arm. Okay. In the case of the bicep, the lever arm is here. Okay. In the case here of the gastrocnemius, the lever arm is here. It's the sole of the foot, right, from here to where the load is. And in the case of the splenus capitis, the lever arm is going to be the distance between now the fulcrum and the load. So basically the front to the back of the head. Okay, all examples of levers. Okay, muscles can have different shapes, and we like to group them according to their shape. A fascicle is an arrangement of muscle tissue that affects its power and its range of motion. If we are talking about a parallel arrangement, what we're looking at here is a group of muscle fibers that look a little bit like as pictured here. Basically, the fascicles run parallel to the long axis of the muscle. Fusiform muscles are where the fascicles are nearly parallel, but they narrow and have tendons at the end. Examples of muscles like this might be the gastrocnemius, the biceps brachii, a couple of examples. What would be an example of parallel fascicles? Probably the transverse abdominis, okay, that muscle that is deep in the midline of the abdominal pelvic cavity and is responsible for compressing the abdominal pelvic contents in part. You can also have a circular arrangement where the fascicles are concentric, and examples of this would be the orbicularis oris and the orbicularis oculi, the circular muscles that surround the eye and the mouth, respectively. Or you could have a triangular arrangement where the fascicles are spread over a broad area and they converge at a central tendon. Trying to think, a good example of that might be the deltoid muscle. Pinnate muscles have short fascicles with various arrangements on the tendon. Examples of pinnate muscles, some of the abdominal muscles you could consider to be pinnate. The serratus anterior you could consider to be a pinnate muscle. It's another example. And so here are examples of each of these, right? You've got circular, triangular, unipinnate, bipinnate, and multipinnate. So when you're looking at the white area here, this is ligament and tendon, and the red area is the muscle tissue. And so you can see what each of these look like. And so it's going to dictate now how the force is applied. And you can imagine that the more insertions you have with fewer origins, the more the force is going to be spread out over a greater area. Whereas if you have one origin in a single insertion, the more focused the action of that muscle is going to be. So back to our picture of the biceps brachii and the triceps. The prime mover is the muscle which contracts to cause the action. So in this group of muscles, the prime mover is the biceps brachii. Now it has a helper, and that helper is actually underneath the biceps brachii. It's called the brachialis muscle, and it has a similar course. It's a deeper muscle. It's deep to the biceps, but it attaches in approximately the same places. So this is the agonist. The antagonist is the muscle that opposes the effect. So in this muscle group, the triceps are going to be the antagonistic muscle group. The synergists are the muscles that assist the prime mover in creating the action. So for the biceps brachii, that would be the brachialis muscle, basically a helper outer. And the fixators are muscles that stabilize the origin of the prime mover. Well, okay, what kind of muscles would those be? Those would be the muscles of the shoulder, things like the supraspinatus, the subscapularis, the infraspinatus, and so forth, as well as muscles like the pec major and minor. They help to lock the origin in place so that when you apply force here, we suddenly don't slide forward, right? The scapula doesn't roll over the top of your shoulder and suddenly end up, out here by your chest. Okay, these muscles help hold it into place. Other fixators include the rhomboids, which are a couple of four-sided muscles that attach to the medial scapular borders. Okay, a compartment is a group of muscles with their nerves and blood vessels that have a common function. How do we name these muscles? It might seem a little confusing at first, but one of the things that we do to name muscle is to look at its direction. Basically, when we're talking about direction of fibers. Fibers can be oblique, transverse, or rectus, meaning what exactly? Okay, well, oblique means at an angle to the long axis of the body. Transverse means at basically a right angle to the long axis of the body, and rectus means parallel to the long axis of the body. So if I were to draw the fibers here, an oblique muscle fiber might run like this, a transverse muscle fiber might run like this, and a rectus muscle fiber might run like this. Okay, so remember that when I'm making these little motions here, we're thinking about a body facing you in anatomical position. And a perfect example of all three of these are the large muscles of the abdominal pelvic region. You've got the rectus abdominis, the transverse abdominis, and the internal and external oblique muscles. So if you want to go take a peek at those in your textbook, that'll give you an example of naming by direction. Okay, we also can class them according to size: minimus, maximus, major, and minor. Obviously, minimus is going to be the smaller muscle in the group, maximus a larger muscle, and the same with major and minor. Major muscles are going to be bigger than minor muscles, and so forth. You can also class them by shape. They can be triangular, circular, or square. And so we group these muscles accordingly. An example of a circular muscle, orbicularis oris, orbicularis oculi, a couple of circular muscles. A square muscle, the quadriceps, the quadriceps, not the quadriceps femoris. I'm trying to think of a better one here. Um, let's see, a perfectly square muscle, good example. It's going to be one of the adductor muscles of the femur, uh, and I believe it is the quadratus femoris, the quad femoris. And if you look it up, it's a square muscle that runs from the medial border of the femur, and it attaches around the pubis of the hip. And what it does is it brings the leg back towards midline. So there's a couple of examples there of a square muscle. Okay, how about a triangular muscle? Well, the deltoid is a good example of a triangular muscle. There's other triangular muscles as well. Okay, there's action. Okay, the muscle can be named by what it does. We've got flexors, extensors, levators, and supinators. Okay, well, we've got some good examples of each of these. The supinator muscle in the forearm is a perfect example of a muscle that has the action in the title. The levator scapulae is a muscle that attaches to the superior border of the scapula, and when it contracts, it lifts the scapula up. It's like a shoulder shrugger. And the extensor palpebris superioris is a muscle that elevates the, let's see here, the lips, muscle that elevates the lips. And there are also numerous muscles that are named as flexors. Flexor digitorum longus is an example. It flexes the fingers. Okay. Okay, they can be named by number of origins. The biceps has 2 origins. Okay, the triceps has 3 origins. Remember, the origin is that part of the muscle that attaches to the immovable part of the joint. And also they can be named by their location. For example, the temporalis and occipitalis muscles of the cranium are named for the bones that they lie on top of. They can also be named by their locations of their origin and insertion, and the classic example is the sternocleidomastoid, which has attachments to the sternum, the clavicle, and the mastoid process of the temporal bone. So another example there. All right. This is just a list of some of the muscles that you'll need to know, and I'm not going to go through every single one of them. You can do that on your own as you review the chapter. But essentially, these are the superficial muscles of the anterior aspect of the human body. A couple of major ones that we can touch on while we're here. We can start up at the top. The frontalis muscle is this muscle in the front of the forehead. The corrugator supercilii are the muscles that allow you to frown. The orbicularis oculi and the orbicularis oris are the circular muscles that surround the eyes and the mouth. The buccinator is the muscle that allows you to blow with your cheeks. Okay. As we move down to the neck, you've got the sternocleidomastoid, which is deep to a big flat muscle called the platysma on either side of the cervical region on the anterior aspect. Okay, we keep moving down. This big muscle here in front of the chest, this is the pectoralis major. Underneath him, incidentally, is the pectoralis minor, and this is a major arm mover. These triangular muscles here are the deltoids. This is the biceps brachii. This is the brachioradialis over here on either side. And then you've got these abdominal muscles down here. The rectus abdominis basically runs like this. The transverse abdominis like so. Okay, with these tendinous inscriptions. The external obliques, their fibers run in this direction, and the internal obliques, which are underneath the external obliques, their fibers run in that direction. The serratus anterior is this sort of sawtooth muscle back here. And then as we move down a little bit further, you see the legs. The sartorius muscle is this S-shaped muscle that runs like this across the front of the thigh. This is the tensor fasciae latae right here. And these big 3 muscles here are 3 of the quadriceps. Okay, this is the vastus medialis. This is the vastus lateralis. And in the middle is the rectus femoris right here. Okay, so where is the fourth muscle? Well, it's underneath the rectus femoris, and it's called the vastus intermedius. And what do those muscles do? Well, they extend the leg. These are the muscles that flex when you want to kick a ball, for instance. Okay, as we move down to the lower leg, you can see a couple of big muscles there. The tibialis anterior is this muscle that runs on the lateral side of the tibia. And this is one of the muscles that allows you to raise your toes off the ground. And then you can see, let's see here, a couple of muscles on the side. The fibularis brevis and longus are muscles that run down the side of the lower leg, and they allow you to evert the foot, basically to rotate the sole of the foot this way, okay, in that direction. And if we flip around to the back, you can see some of the broad muscles of the back. We'll be hitting a lot of these in detail. Splenus capitis is up here. This big diamond-shaped muscle, that's your trapezius. This big broad muscle is the latissimus dorsi. There's the gluteus maximus, the triceps brachii, the deltoids. Okay. Down here you can see these muscles. These are the hamstring group. All right. And so, what are the muscles of the hamstring group? Well, the biceps femoris, the semimembranosus, and the semitendinosus. Now, how do I remember who is who? Well, it's kind of tricky. The semimembranosus I remember as being the most medial muscle of the hamstring group. So M for medial, M for membranosus. Okay. The semitendinosus is this sucker right here, which is just lateral to the membranosus and superficial to it. And the biceps femoris is this guy right here. Down here's the gastrocnemius. This is the Achilles tendon, and this is the calcaneus. Okay, so that's just a quick drift through some of the muscles on the posterior aspect. We're focusing today on the head and neck, so let's kind of get into a little bit of detail here. Basically, when you're looking at the muscles of the head and neck, the muscles around the cranium are named for the bones of the skull that they lie on top of. So the frontalis lies on top of the frontal bone, the occipitalis on top of the occipital bone, the temporalis on top of the temporal bone. And then as we move down, lateral aspect, we can see some of these other muscles. There's the sternocleidomastoid that we talked about. Remember that I told you it connects to the clavicle, the sternum, and the mastoid process of the temporal bone. Okay, well there's the mastoid process of the temporal bone right behind the ear. So that's one of the attachment points for the sternocleidomastoid. Notice that it runs under this big flat muscle. This is the platysma that I was talking about. So it's superficial here, and now suddenly it's deep. Okay, what's this muscle here in the back? Well, this is the top of the trapezius. Okay, this is the levator scapulae. Remember I told you that there's a muscle that attaches to the superior border of the scapula, and when it flexes, it lifts the scapula up. There's the levator scapulae. There's the splenus cervicus, okay? And there is the splenus capitis. Basically, these are muscles that attach to the base of the back of the skull, and they allow you to tilt the head left or right, or tilt it back if both muscles on either side flex at the same time. Okay, so that's the back, the sides here. This muscle here, this is the temporalis muscle, lies on top of the temporal bone. There is the orbicularis oculi, the round muscle around the eye. And then these two guys here are the zygomatic major and the zig minor. Now, how do you know which is which? Well, there's the zig major. Look how long it is. It's longer, so it's bigger than the zig minor. The minor is superior to the zig major. This muscle is named for its location. It attaches to the zygomatic bone, which is the cheekbone. Okay? And a major and minor are indicators of their size. Okay, as we move down here, right, what's this big guy? This is the masseter. This is one of the muscles that helps us chew. Okay, so what does the masseter do? The masseter allows us to move the mandible, the only movable bone in the skull. In animals, the masseter actually attaches all the way up here to the top of the head to a bony ridge called the nuchal crest, which we have lost. And that's why if you watch a dog or a cat eat, one of the things that you see is the top of the head moving while they chew their food. They also are able to produce, as a result of this, a lot more power when they eat. That's why they can do things like bite through bones and rocks. And we can't do that. We've lost that power. Okay. Here's the depressor anguli oris. Okay, if you follow up here. Now, here's an example of a muscle that's named for what it does. Okay. It depresses the labii. Where are the labii? They're the lips. Okay. So depressor anguli oris right there. And they depress the lips at what? At an angle. Okay, so they turn the corners of the lower lips down. So you might use this muscle when you frown, for instance. Okay. Okay, the levator anguli oris, if you look here, this muscle. Okay. Well, what do you think the levator anguli oris does? Well, it elevates the upper lip at the corner. So this is one of the muscles we use when we smile. Okay. I think that's about all the muscles we want to talk about at the moment. Okay, so these are the muscles that move the scalp. The occipital frontalis is sometimes considered a single muscle group. This broad flat tendon here is called an aponeurosis, and what it does is it connects the frontalis to the occipitalis and allows the scalp to move. Okay, these are the muscles of the face from the front. All right, what you're looking at here, a lot of the muscles we've already touched on. You can see, of course, the frontalis. All right, you can see the orbicularis oculi, the temporalis, the zig minor and major, the rizoris. Okay, the rizoris is a muscle that attaches to the corner of the mouth and then runs back and attaches essentially to the just posterior to the superior portion of the mandible. And what does it do? It allows you to basically bury your teeth, right? Pulls those lips back, and not like a snarl, but like you're gritting your teeth when you're concentrating, say, really hard. There's a depressor labii inferioris. See a point of attachment here to the lower lip, and it pulls the lower lip down, so you can show your teeth when you move these muscles. All right, your lower teeth. The depressor anguli oris, okay, again pulls the corners of the mouth down when you frown. And the depressor anguli oris, which has a similar action. Okay, other side here, we've got some muscles that also act on the tongue. Okay, so what do they do? The omohyoid, the hyoid muscles, basically attach to the hyoid bone. Remember that the hyoid bone is the only bone in the body that does not articulate with any other bone, and that serves as the origin for muscles that move the tongue inside the oral cavity. Masseter we've touched on. The buccinator we've talked about. That's your blower muscle. Levator anguli oris we've touched on as well. The nasalis allows you to wrinkle the skin on the bridge of your nose. And there's the corrugator supercilii, which is your frowner. Okay, so muscles that move the mouth, the orbicularis oris, the zig major and minor, levator labii superioris and depressor labii inferioris, the depressor anguli oris, the buccinator, the rizoris, and the mentalis. Okay, so the mentalis muscle, I'm looking here, should be down around where the chin is. This is the mental foramen right here, and the mentalis muscle is this little muscle right here. Okay, you can see it. It's a deep muscle. This is the superficial side of the muscles of the face, and this is the deep side here. Okay, so the mentalis is a deep muscle. Mentalis you might use, for instance, if you were, say, sucking on a straw. Okay, it would help sort of wrinkle the lower lips. The platysma we've already talked about as well. That is a muscle that allows you to, again, wrinkle the skin on the lower jaw and on the neck. Okay, so, all right, more muscles of facial expression. The orbicularis oris moves the mouth, as does the zig major and minor, and the levator labii superioris, and the depressor labii inferioris, the depressor anguli oris, the buccinator, the rosaris, the mentalis, and the platysma. Muscles that move the orbit in the eyebrows include the orbicularis oculi, the corrugator supercilii, which is your frowner, the frontalis, and the muscles that move the orbit in the eyebrows include the orbicularis oculi and the corrugator supercilii. It's shown here. There's the orbicularis oculi, there's the corrugator supercilii, there's the frontalis right there. There's the orbicularis oris, right, and the depressor labii inferioris, and there is the zig major. Okay. All right. Muscles that move the mandible so that you can talk and chew include the masseter, the temporalis, the medial pterygoids, the lateral pterygoids. Where are those muscles? Well, let's take a peek at them, okay? If you're going to talk, you're going to have to move the mouth. You're going to have to move the mandible and move the lips so that you can form sounds. Now, if you look here, you can see the orbicularis oris, that moves the lips. There's the buccinator, that allows you to blow. You might use this, for instance, when you whistle. The lateral pterygoids are these guys back here. You can see them towards the back. And you can see here the zygomatic arch and the zygomatic bone, which is cut away so that we can see some of these deeper muscles. This is the ramus of the mandible, and this is the masseter right here. The medial pterygoids are underneath the masseter, so these are deep muscles. And what they're showing you here is that these pterygoids attach now to the, not the outside of the jaw, but the inside of the jaw. So you could think of them as having a similar action to the masseter, but they're doing it from the medial aspect of the jaw instead of the outer aspect. So again, to move the jaw up and down. Okay, muscles of the anterior neck are important in swallowing and speech. These include the digastrics, the stylohyoid, the mylohyoid, the geniohyoid, the omohyoid, and the sternohyoid, and the sternothyroid and thyrohyoid. Now, where are they? They're all here. And all I'm going to say about these muscles is that they're important in moving the tongue. There's the hyoid bone. Now, all of these muscles have hyoid in the name. And the reason they have hyoid in the name is that they attach to the hyoid bone. Now, let's use a little logic here. The sternothyroid muscle, what do you think it attaches to? Well, the sternum and the thyroid region of the throat. The thyroid gland, remember, is a butterfly-shaped gland that lies right in front of the trachea, right about here. So the sternothyroid has two insertions here on the sternum and on the thyroid region of the trach. Okay, how about the thyrohyoid? Well, it attaches to the hyoid bone here and also the area near the thyroid gland. Okay, so you can see the thyrohyoid right here. And again, remember that this is the superficial side, this is the deeper side. Okay, the mylohyoid up here is this muscle that runs essentially at a right angle to the long axis of the body. The stylohyoid muscle, this little guy right here, and it attaches to the hyoid bone and to the styloid process of the temporal bone. Okay, that's why it's called the stylohyoid. Okay, the sternohyoid muscle attaches to the hyoid bone, there it is, and to the sternum. Okay, so if you follow this, right, there's the hyoid bone, there's the sternohyoid muscle, and we're going to go all the way down here, and we're going to attach to the sternum. What is the sternum? The sternum is your breastbone. Okay, and then finally over here, the omohyoid. Okay, attaches to the hyoid bone and the omoclavicular process, which is part of the collarbone. Okay, all right. I think that's pretty much all we want to talk about on this particular diagram here. Here's just some deeper muscles of the neck. You can see the omohyoid here. All right. So here it is running from the hyoid bone all the way down to the clavicle, okay? And over here, you've got the thyrohyoid running from the thyroid up to the hyoid bone, the sternothyroid, which we've already addressed, and the sternohyoid, okay, running from the sternum to the hyoid bone. And again, it's been cut away on this side so that you can see the deep muscles, and here it is in the superficial aspect, okay? Okay, muscles of the anterior neck, these are very, very deep muscles. They attach to the vertebral column and to the first few ribs. These are called the scalenes. You've got the anterior, middle, and posterior scalenes. And what do you think they do? They keep the neck straight. They keep the neck erect. Okay, so very important in keeping your head upright. There's C1, the atlas. There's the axis underneath it. There's the dens, the orodontoid process. And there's C3. So we're looking at here the front of the cervical division of the vertebral column. And these are the first two ribs you can see right there. Okay. So muscles of the anterior neck for raising the ribs during inspiration and for keeping the neck straight as well. Okay, the scalenes are what we've discussed. Okay. Prevertebral neck muscles, these are muscles that sit in front of the vertebral column. That's why they're called prevertebral. They include the pectineus, or the rectus capitis anterior, the rectus capitis lateralis, the longus capitis down here, the longus coli, and again, they're named for the direction of their fibers and their location. These are the bony attachments to the neck, and what they're showing you in this diagram is where each of these muscles starts and each of them stops. The origins are shown here in red, the insertions are shown in blue. And so, how do you figure out the action of a muscle? Well, you start at the origin, okay? So let's, for instance, look here at the longus coli, just for fun, okay? Where are the origins? These red dots, see them here, 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 and here. Where are the insertions? There's the blue dot. Okay, well, what do you think the longus coli does? It helps to rock the cervical region forward when it flexes. Okay, you can do that with any of these other maps. Now, if you look at the skeleton that we use in lecture, one of the things you'll notice is it's got red and blue shapes painted on the bones, and what those are origins and insertions. And so if you can visualize the muscle in between those two regions, you can figure out the action of the muscle when those two regions get close to each other, and that'll give you an idea what the muscle actually does. Here are the muscles of the lateral neck. You can see here the sternocleidomastoid, which we've previously discussed. There's the digastric muscle. This is the posterior belly of the digastric. There's the hyoid bone. Okay. There's the omohyoid muscle. There's the digastric muscle. And there's the trapezius, the broad flat muscle of the back. This is considered the posterior triangle of the neck. This is considered the anterior triangle of the neck. Now you might ask, well, you know, I'm in massage therapy, and when am I going to be dealing with the muscles of the anterior neck? And the answer is probably not very often. Those are muscles probably more akin to what speech therapists deal with. So if you know anybody that works in speech pathology, they probably know a lot about these anterior muscles of the neck. You probably will, and I would say I almost guarantee that you'll be interested in these posterior muscles of the neck, things like the trapezius, the sternocleidomastoid, the splenus capitis, and so forth. And the reason for that is a lot of times you get the sore neck. The soreness often comes here from these big broad muscles in the back. Remember, they have to keep the head upright, and so they get a lot of strain. Okay, so muscles of the lateral neck moving the head, including the sternocleidomastoid, is one of the primary movers. These are again just the attachment sites on the posterior, the inferior base of the skull. There's the foramen magnum. These are the occipital condyles, just to orient you. And what you're looking at here, again, the insertions are in blue, the origins are in red, and you can see where all these different muscles attach. So if you bother to look at where the blue and the red share a muscle, you can figure out what the muscles actually do. Okay, you can pick it out. Trying to see if I can find one with an origin and an insertion in the same area here, and I'm not picking one up in this particular diagram. Okay, you've probably heard of people in car accidents that get rear-ended. One of the things that can occur when they get rear-ended is that you can force the cervical region backwards, and this can result in injury to the posterior aspect of the spine. This is called whiplash. What happens is these intervertebral discs can get crushed, these spinous processes can get injured or fractured, and you can compress these cervical nerves. Okay, they can press on these little spinal nerves in the cervical region, and that can have consequences. It can lead to numbness or, in some cases, paralysis if you're not careful. So here you can see this is the cervical sympathetic chain ganglia that lie lateral to the spinal cord, running basically all the way up and down the length of the vertebral column. They're outside the bones that make up the vertebral column, and they're basically stopping off points for the autonomic nervous system. But in whiplash, what can happen is that you can injure these lateral nervous structures. Okay, so you can get hyperextension, and then the head can rock forward, and you can get compression. Okay, any of these types of injuries. What are the muscles that can be affected? Well, you can injure the sternocleidomastoid, the trapezius, the scalenes. Okay, the ligaments that can be affected include the ligamentum nuchae. Well, that's basically a ligament that attaches to the nuchal ridge, which is basically a protuberance on the posterior medial border of the occipital bone. Okay, and you can also injure these intraspinous ligaments and these anterior longitudinal ligaments that run very, very close to the vertebral column and maintain its posture, its structure. You stretch and tear these ligaments, you can get very deep and painful injuries that take a long time to heal. Here you can see an example of a compressed nerve here. Looks like we've got something going on around C4 and 5. Okay, you may get some numbness and tingling in the area that's served by the cervical nerves that exit these vertebral foramina. All right, so things to be aware of. Now, what follows this presentation is a muscle presentation on the facial muscles, the muscles that actually move the face and the neck, that I put together, that I think is very worth watching. What you'll see is a facial action. Then you'll see the muscles that perform that facial action, and it will list the origins and the insertions, and it'll show you using a graphic where those muscles are located. And it's a nice way to review some of the stuff we've talked about in this chapter. So stay tuned, that's coming right up, and I'll see you guys in